Okay, so I want to just address the subject of glute massage, because a lot of people ask why we insist on including the glutes in the area. Now, the truth of the matter is, if you have got lower back pain, the muscles that stabilize your pelvis, stabilize your spine, they all run through the glutes. Not that the glutes themselves, the glute muscles, the ones that you see obviously when you're wearing a pair of shorts, it's not necessarily those muscles that are problematic. It could be the muscles lying underneath it. And we would always encourage that somebody who's got low back pain gets it massaged. I just want to talk about the draping, because for us there are three things that prevent us from doing quality work on someone's back. The first is the comfort levels of the environment. If the environment itself, meaning the bed, the towels, the heat, the temperature in the room, if it's not conducive to you receiving that massage, then we can't really do anything. So we would have to get that right first, just as a first off. Otherwise, what you're lying there is you're lying and you're feeling cold or exposed, and that's going to be unhelpful. We can't work on you in those conditions. So you've got to be warm. You didn't come to be warmed up. You came for a massage. So if we spend our life putting deep heat on the muscles or hot stones, and that's all we're doing, we're just warming you up, you're not getting massaged, you're getting warmed up, and that's not what you're paying for. You're paying for the tissues to be stretched and warmed up, okay? So heat is a big issue. The second biggest issue would be pain. If we're stretching you so hard, or digging into a muscle so hard that the muscles on the other side are pulling to get away from the pain, you're just simply tightening up other muscles, and it's useless technique. Going hard is not the goal. Hurting you isn't the goal. The goal is to successfully stretch the muscles so that you feel relief in that body system, not just crush you with pressure. There are times when we have to press that boundary, when we've got to push that limit, right? But what that's going to be based on is whether or not we compromise your breathing. So if I'm stretching the muscle and you can't breathe, useless. So if I can stretch it and you can breathe through it, like a deep exercise, like a solid squat, and we can work together, that would be the ideal. That's really going to be helpful, and you will feel that for 2 days after that massage. You'll feel like, oh gee, I feel almost bruised in the tissue. That's a successful massage. It got you to the point where you were able to concentrate on where you were at, relax the tissues while we stretch them. You will get relief out of that. That'll have improved the mobility, the movement, the range, the power, the strength, whatever you were trying to accomplish in those tissues at the time. But it's breath dependent. If it's so hard that you brace your breathing and you stop breathing in order to endure the pain, that's useless. That accomplishes nothing. And deep tissue is not about just simply applying as much brute force as we possibly can into the tissues. That's actually really poorly educated massage technique. So no to that. Yes to being able to have a conversation. It doesn't have to involve words, but it's got to be able to be a conversation where a therapist is listening carefully to the way the person is responding to that particular stretch. Pain only, not successful, not helpful. The thing that really bothers us as therapists is going to be the thing that we won't know about. We don't know how people interpret our touch. So some people, I could be as caring as in my head that I think I'm really caring for this person, and in the person's head they're experiencing me being aggressive and hurtful. Now, that's not happening on my part. It might be happening in their head, but I would have no idea that that's what's going on in their head. So that's my blind spot. It's the area that I have no control of, and I absolutely have to have my client's permission or a conversation around, no, I'm feeling exposed, I'm feeling like that's too much. If that's not the case, then what's going to happen is you're going to endure the massage, and it's going to be an unsuccessful experience. So it's much easier if we explain where we're working, what we're going to be doing up front, so that you know what you can dress yourself in, and how you want to feel safe and confident. Now, we address this because when it comes to runners, athletes, people doing high rocks, they're doing, you know, squats all the time, burpees, those individuals walk in and they've got lower back pain, and we say, well, I'm going to need to work the glutes. Now, I don't need to use oil, and I don't need to touch skin to massage your glutes. There's lots of different styles that I can use to access the glutes and to successfully, you know, give you a proper change in the way that muscle is operating. If at any stage that I've got my hands on a client and that makes you feel exposed or vulnerable or unsafe, that's my kryptonite. I'm not going to know that that's how you're feeling, and so I'm thinking that I'm helping by persisting in this area, and I might even misread how you're groaning about the pain, but what I don't realize is that I'm working too hard on you, or that I've exposed you where you weren't prepared for that, or you didn't want it. So clothed sports massage is your answer. If you don't like being exposed, don't do it. It's a mistake. You're not trying to push boundaries here. You're not going to accomplish anything by doing that. So do a clothed sports massage. Movement therapy will also be clothed. Thai massage is clothed massage. You don't have any oil involved there, and it doesn't have to be hard. It can be a gentle stretch. It doesn't have to be a painful experience. It can be a healing experience. It just depends on you, where you are emotionally saying yes to the exposure or no to the exposure. So that exposure becomes a significant problem for us if the person is feeling like, no. Also, if you're not comfortable with a male therapist or with a female therapist, find the person that you are comfortable with. Find that person and work with that person. But don't be afraid of telling us, this is where I feel I have a problem. Because if you don't, the hinting at it doesn't help either. So a clear path to success is going to be openness between therapist and client. This is what I'm feeling. This is where I've got a problem. This is where I'm feeling that I'm sore or tight, and also knowing the difference between I'm feeling sore versus I'm feeling tight, or like I can't move that area. Knowing the type of problem would help us out a lot. So just bear those three things in mind. It's winter at the moment, and the heaters are on. The hot stones are free. We don't charge for hot stones because we use them to warm you up. It's a tool. The amount of pain or the amount of stretch that we're giving you is something that you can communicate to us, tell us about it beforehand. And also, if you're not feeling like it's helpful, if we're being too light or too hard, tell us. Don't lie there and endure. And then lastly, exposure. What we take off or undress is a personal choice based on you. It affects which massage style we perform on you. But other than that, rather make sure that you are feeling very confident in our presence. Otherwise, it's going to be an unsuccessful experience. So I hope that helps address just, covering the glutes versus not covering the glutes.